In the early 90s, some researchers decided to experiment with a drug for the treatment of angina pectoris. I don't know if you've ever heard of it, but angina pectoris is chest pain believed to be due to the constriction of coronary arteries, which are the small blood vessels that nourish the heart. When they narrow, the heart can suffer, and you feel unwell. There was this new drug that seemed like it could help people with heart problems. Unfortunately, as often happens in scientific experiments, this trial was a complete failure. In fact, after just a month, given that the results were less than zero, the researchers rightly decided to withdraw the drug and stop the supplies to all participants. Nothing out of the ordinary, you might say. However, something incredible, literally incredible, happened a few days later in front of the entrance gates of this testing institute. Every day, the participating patients and their wives gathered there, loudly demanding to get this special molecule again. The early 90s will go down in history for the birth of Viagra. When you take the little blue pill, the phosphatase enzyme is inhibited, allowing you to have continuous and consistent erections. Are there any risks? What if an erection lasts too long? Well, if an erection lasts for 3 to 5 to 10 minutes maximum, that's no problem. But when an erection lasts too long, there could be negative consequences. The trapped blood may lose oxygen, and without oxygen in the blood, tissues suffer. When tissues suffer, they may undergo necrosis, and then they are replaced by scar tissue. Therefore, a healthy and safe erection can last 5 to 10 minutes, maybe 30 minutes, perhaps an hour, but it shouldn't exceed this time limit. This risk, of course, is much more common in young and healthy individuals, where the mechanisms that trigger erections are functioning properly. However, in other situations, some people have mechanisms of erection that don't work as well. Some gears may have gotten a bit rusty, so in these cases, the pill is quite useful and necessary, and it doesn't come with risks but offers many benefits. I'm talking about people who, due to aging or specific issues, have cardiovascular difficulties, narrowing of blood vessels that nourish their little friend, and they truly need an increase in dilation, which would greatly help them in their sexual life. Despite all the pills having more or less the same effect I described earlier, there are still some nuances to consider. Actually, each of them works slightly differently, and for this reason, they have their own advantages and disadvantages. Take Viagra, for example. It has a duration of action of 4 hours, meaning its benefits last for the subsequent 4 hours after intake. Its effects then fade away. However, as a side effect, you may experience gastrointestinal disturbances, and quite characteristically, you might temporarily suffer from visual alterations, seeing things with a blue tint, exactly like the color of the pill. On the other hand, there's Cialis, which is probably even more widely used today than Viagra, because it works for a whopping 36 hours. You might say, 36 hours of erections, that sounds bad. And as we mentioned earlier, it can be potentially risky. However, if you take smaller doses daily, you'll continue to experience sufficient vasodilation to keep you ready and alert whenever needed. The most common side effect of Cialis is back pain and musculoskeletal discomfort. But please note, for both Viagra and Cialis, these are all temporary effects and typically affect only a very small percentage of individuals. You might be wondering, are there any risks? Because honestly, I'm not a fan of taking medications. Well, you have every right to be cautious, but fortunately, there are no serious risks, such as death or irreversible issues associated with these drugs. You may have heard about someone having a heart attack after taking Viagra or Cialis, but in reality, it's not the medication itself. It's the high-impact sexual activity that could be dangerous. It's logical that if you've just had a heart attack or have a serious heart condition, you should absolutely discuss it with your cardiologist before taking Cialis or Viagra, even though, as I mentioned, the medication itself poses no risks other than some very mild temporary side effects. However, here's a caveat. And pay close attention here. In some people who have heart problems and are taking nitroglycerin-based medications, the combination of nitroglycerin with Cialis or Viagra could indeed be fatal. This is because nitroglycerin increases nitric oxide in the blood, while Cialis and Viagra reduce nitric oxide elimination. The result could be an excess of nitric oxide in the blood, potentially causing an instant heart attack with a high likelihood of death. So let's put an asterisk next to this one. And let's make it clear to all our friends, if you take Cialis and Viagra, Be cautious and avoid mixing them with nitroglycerin. It's also not at all unnecessary to mention that if you have kidney or liver problems, it's better to discuss it with your doctor beforehand because the effects of the medication could last much longer and things could worsen without you even realizing it. Are there cases where these pills don't work? Well, yes, indeed. In some situations, some of us might not experience any effect, even with Viagra or Cialis. What are the most common reasons? 1. Dosing. Don't worry too much about this one. Doctors usually start with a very low dose, and it's highly likely that if you report it didn't work, they'll increase the dose and you'll see great results. 2. Emotions. You might not know what to expect, and the uncertainty and excitement can release a surge of adrenaline in your body, potentially inhibiting your erection. However, after a few tries, you'll get used to it, realize there's nothing to be anxious about, and you'll be able to fully enjoy your sexual activities just as you deserve. The third most common reason for Viagra and Cialis not working is alcohol consumption. It can be a real buzzkill for these pills and should be eliminated from your habits if possible. But let's say, even if you're careful with all these things, the little blue pill still doesn't work and you're truly desperate. Is there nothing else you can do? Well, hold on a moment. There are still effective remedies at the second level of therapeutic effect. There are injections directly into the penis with specific medications to aid in achieving an erection. These are very effective solutions but can be a bit more difficult because you need to schedule an appointment and do the injection at just the right time. If you're not comfortable with injections, there's another remedy that still works and has been tried by many men. It's the vacuum effect with a suction device similar to a vacuum cleaner. You place a cylinder over your penis, creating suction that increases blood flow to the area. Importantly, you must use a hemostatic ring at the base of your member to prevent blood from flowing out. But let's consider that for one reason or another, you may be too young to take pills, or you've had an injection that's resulted in an erection lasting too long. What can you do to solve the situation? Keep in mind that a time limit could be around 4 hours. After 4 hours of hypoxia, you would actually end up with an oxygen deficiency, so severe as to lead to scarring and loss of function of your dear friend down there. So, if it's been 2 hours since you had the erection and things aren't improving, here are 3 important steps you can take. 1. Orgasm. Achieving ejaculation can help lower your flagpole. It releases adrenaline, which can assist in easing the situation. 2. Physical activity. Engaging in high-intensity physical exercise can also promote the production of internal adrenaline, helping to lower your flag once more. Go for a run or get some exercise to stimulate adrenaline production. 3. Stress or fright. Getting into a stressful situation or experiencing a scare can also help. For instance, you could argue with someone or intentionally induce a sudden fright, which might assist in resolving the issue. But if you're in a real emergency and can't resolve the problem, consult a doctor or visit a pharmacy. They can provide medications containing adrenaline that might quickly resolve the situation. If neither pills nor injections work, there's a third level of help available. Surgery. In this case, a surgeon can recommend a proper implant. One type is the semi-rigid implant, which is made of a material similar to metal. It's semi-rigid, meaning you can keep it down when not needed and straighten it when required. Another option is a hydraulic system that mimics what happens naturally in your organ. There's a pump inside the scrotum that circulates water, filling the cavities of your penis, making it hard and strong. However, keep in mind that these surgical interventions are usually permanent and cannot be reversed. Once you insert them, the surrounding tissues may become damaged and lose their original functionality. But let's say you don't like the idea of medical interventions and want to pursue natural methods. Or maybe you've had prostate surgery, which could affect the nerves responsible for your lower regions, and you want to regain your sexual function naturally. What can you do in this case? There are some very natural aids that can be highly effective. The first and, in my opinion, the best of them all is cocoa. Cocoa is rich in flavonoids, which can have a positive impact on your sexual performance by significantly increasing the production of nitric oxide, dilating your arteries, and promoting cardiovascular health. However, be aware that natural nutrients like cocoa are complex, and it's nearly impossible to replicate their effects with supplements or pills. It's much more beneficial to incorporate them into your diet. Another natural friend to men and their erections is pistachio. Pistachios, especially the high-quality ones from places like Bronte, Sicily, and Turkey, have been shown to improve erectile dysfunction in studies conducted in Turkey. But are there other foods that have the same effect as Viagra? Well, there are some others. Ginseng, ginkgo biloba, ginger. From a physical perspective, high-intensity weightlifting and exercise have been shown to have similar effects to Viagra. A group of individuals who trained 2 to 3 times a week for 3 months saw improvements in their muscle mass, cardiovascular health, and erection quality. In summary, Viagra and Cialis are generally safe and can be beneficial, especially for older men. They have minimal and usually temporary side effects. If you're young, you may not need them. Don't rely on supplements or pills to enhance your size. Instead, focus on listening to your partner's desires and building a healthy relationship. Regular physical activity, a diet rich in cocoa, pistachios, ginseng, ginkgo biloba, ginger, and lots of fruits and vegetables can help increase nitric oxide in your blood, benefiting your sexual health. If things aren't working as expected, there are still other options, such as the injections, the vacuum devices, or even surgical interventions, although these should be considered as a last resort. Share the video, spread it, because let's face it, it's a problem that sooner or later everyone will have. Let's not kid ourselves, and maybe this little pill thing you've already thought of it yourself. Don't be embarrassed, go to the doctor. Talk to him, ask him, or maybe even talk to your friends who may already be using it. Share the video, like us, subscribe to the channel. We will continue to make quality videos. Keep following us because it is absolutely worth it. See you next week with another video. Bye and thank you.